Hi everyone, we're back with the new nurse, uses of narcotics in the clinical setting. First we're going to discuss this patient called Jake. His nurse is saying to him, Jake, can you please answer me? Of course, Jake is lethargic, respirations are shallow. Well, let's find out his history. Jake is an elderly gentleman who was admitted for prostate surgery. He was very agitated during the night and was given Ativan, 1 milligram, as ordered, around 2 o'clock. That was in the morning. It is now 7:30 in the morning. The day nurse is doing rounds, and she's unable to awaken Jake. Something is obviously wrong. Helpful hints: it would be important to monitor his neurological status, his vital signs, O2 sat, and of course it is important to notify the MD, because this guy is obviously having some kind of a reaction. Again, always assess and document. Here is another patient. Here's Vicky. She's just received morphine about 30 minutes ago. 5 rights were followed. Some people say there's 6 or 7. I'm just going to go with the 5. Then why is she seeing people dancing in front of her? Well, it is not uncommon, especially in older people. Some of them do have, even young people can have narcotic reactions, even when everything is done to perfection and there are no known allergies. There are many patients who have stories on record to tell. Like one patient said, after receiving a narcotic, she saw people come with a coffin to take her away. Isn't that frightening? But people will tell you different stories after receiving narcotics. They're not always happy ones. Some people are terrified after they've got them because of the reaction. So always be aware that if you medicate a patient, you should take the trouble to follow up and see how that patient has reacted. Doesn't happen to everyone, doesn't happen all the time, but there's nothing wrong with being cautious. Let's take a look at the description of narcotics. Well, what is a narcotic? Narcotics are commonly used in the clinical setting. They are controlled substances, and their uses include, but are not confined to, pain control, decrease in anxiety, and they're also used widely as anesthesia. Common drugs, I'll just give you a few: morphine, Ativan, also known as lorazepam, fentanyl, hydromorphine, hydrocodone. Side effects, again, but are not include but are not confined to hallucinations, mental confusion, lethargy like in the case of Jake, decreased respirations, hypotension, which is also known as low blood pressure, and itching and skin rashes. So here is my suggestion. If you have a patient whom you've medicated with a narcotic, it is rather important to do an assessment before and follow up. Typically it's about 30 minutes later, checking to see what, depending on the route of course, because drugs that are given IV work very quickly. So depending on where you work, follow your institution's policies and procedures and doctor's orders, and do